There's growing concern now about a spring COVID surge across the country. New York, New Jersey, and Connecticut are among the 27 states reporting a rise in infections over the past week. CBS News' John Diaz live at Bellevue Hospital in Manhattan this morning with more. John?
Chris and Mary, good morning to both of you. Well, local health officials are saying that hospitalization rates, they are definitely increasing here in the city. But when you compare them to infection rates, though, they are much slower on the uptick. Now, these hospitalizations really impacting those who are unvaccinated. However, though, hospitals, they have issued new guidelines.
With some COVID restrictions slowly inching their way back, it's a familiar feeling again around New York City. City hospital officials have announced new visitation policies. All visitors must show proof of up-to-date vaccinations or have a negative COVID test within 48 hours. And patients can only have 2 visitors at a time. And at Columbia University, mandatory masking is back. Non-cloth masks are required in classrooms only for the remaining weeks of the spring semester.
A lot of my friends around me have been getting COVID recently, so it does make me more comfortable to have masks on, but I also feel like it's sometimes inconsistent.
The city's health commissioner says because of the rise in cases, he expects the city's COVID alert level to go up from a low to medium alert risk level next week.
We are going to see a significant rise in cases. The good news is, and I want to reassure New Yorkers, this is about preparation, not panic. It's not about anxiety and worry.
The daily infection rate has risen from 760 on March 8th to more than 1,800 on April 5th. 4.03% positive daily average. It was 1% after the initial Omicron surge.
We are starting to message to New Yorkers that they need to be taking precautions, especially around masking in indoor settings.
And the mayor's new COVID diagnosis has put the spotlight on the new surge across the Big Apple. He was given an antiviral medication available to New Yorkers free of charge and held a virtual press conference yesterday as he recovers.
Mere fact that I'm able to, I believe, fight this virus with just a raspy voice is because I took the necessary steps of getting boosted and vaccinated.